Access to primary healthcare remains a struggle for millions in South Africa. Public clinics and hospitals are often congested, forcing people to wait for hours, and sometimes they lose a full day's of wages just to see a nurse. The Sha'p Left nurse surgeries is an initiative of the Cipla Foundation, and it was created to change that by placing affordable nurse-led clinics directly inside community hubs. And now with a new partnership from the FirstRand Empowerment Foundation, this model is set to scale. And joining us to talk about the initiative is the CEO of the Cipla Foundation, Paul Miller. Hi, Paul. Thanks for joining us today.
Thank you, Linda, and thank you for the opportunity to speak about this.
Okay, before we talk about this FirstRand Foundation collaboration that you're doing now, can you tell us a bit more about the Sha'p Left nurse surgery? It's quite a nice name. So how does this model work on the ground?
So, Linda, you started with the intro, really clearly stating the challenge we have in South Africa. So many people are looking for access to healthcare, and for many, it's a privilege. And we know the state institutions are congested, they're overwhelmed, they're underfunded. And so for many people looking for good health care, it probably means taking a day's leave to go to hospital to get that care. At the same time, we also know the employment rates in this country are very low. And there are many, many people out there that have the skills, have the capability, but we're just not deploying them. And so from Cipla's perspective, we saw these as two incredible opportunities. What if we were to identify nurses that would be prepared to work in the community and provide access to healthcare at an affordable level for those seeking this level of care in the private sector, not in the public sector? And I think that was the intention, that was the idea about trying to get these two challenges together and finding a solution with these nurses that could potentially scale up this access for us.
So how long has this been going on, these nurse surgeries?
Sure. We've been building these nurse surgeries across South Africa for many, many years. And the exciting part is that we've now managed to hone the model in such a way that the nurses actually can become self-sufficient and make money and become sustainable and profitable. And I think that's very exciting. Many of these nurses come out the public sector. They're looking to actually build their own businesses. And I think this model has been perfected over the last couple of years. So we've looked at education, we've looked at SOPs, we've looked at actually where's the best place to deploy these units and where is the greatest need. And I think what's exciting now is through our partnership with FirstRand, we're now able to scale this up, not just to 1 or 2 or 3 or 5, but as many as 50 and 60 over the coming period.
So for somebody who goes to one of these nurse surgeries, what does it cost them?
So for 350 Rand, they get a consult plus all their medicine. So it is definitely targeting the community where affordability is critical, but more than just affordability, it's got to be quality, accessible healthcare. And so at that price point, we know we can actually not only help with diagnosis, with any laboratory testing, or getting consultation from a medical practitioner beyond the nurse, but also we can give them the medicine that they need to alleviate any symptoms or conditions they're living with.
Well, you mentioned the number of clinics you want to scale to. So in which provinces would this be?
Primary 3, Gauteng, the Western Cape, and KwaZuluNatal. And the reason for that is just we don't want to spread ourselves too thin in the beginning. We want to stay in provinces where we have presence and we have support. But our vision for this is that it could become a national picture and that every province would be represented.
So tell us a bit more about the work of Cipla. This is not the only thing you do in South Africa, and you also supply vaccines.
We do. So in our foundation, what we've also done, we've come to realize that not only is it about affordable access to healthcare through the nurses, but people that get their chronic medication from the government, particularly things like HIV or diabetes or respiratory asthma conditions, pretty much take a day out of every month or every second month to collect their medication. And I don't know about you, but I think, Linda, to blow a day just collecting your medicines is just not acceptable. And I don't think many employees would actually tolerate it. So what we have done is we've worked with the government to decant the patients out of the government hospitals and actually to go and collect their medicines in the taxi ranks where people live. And we have these pickup points now, over 50 of them around the country, where patients can go and collect their chronic medication. So important, because if you take treatment like HIV, ARVs, if you don't take your ARVs and you maybe skip a week or skip 2 weeks, you will build resistance. And if you build resistance, then that treatment won't be effective for you. And obviously, the consequences are quite dire for people living with HIV. So this has been a very critical area of focus for us. Now, we think we could pair up the pickup points also with the Sha'p Left nurses and put these 2 points together. So not only can you collect your chronic medication, but you can also get treated with acute in the private sector as well. So making these nurses' impact in their society even so much greater.
Well, you mentioned that the nurses are now becoming entrepreneurs. Is there a specific story about a nurse or a patient that you could tell us to illustrate, how it makes a difference in their lives?
Yeah. I won't give a specific one, but what I will say about my experience is that a lot of these nurses start off having worked in the public sector. And it's a privilege to have worked there. But they find themselves in an environment now where they have to run their own business. And this is fascinating, because now all of a sudden they have to worry about the rent, they have to worry about the lights, electricity, the nursing staff that support them. Not only that, but also they actually like to prescribe up to Schedule 4, because it's got special qualification. So this is equivalent almost to a general practitioner that you would go and visit. So the ability for this nurse to have impact in her community, in her society, is unbelievable. So she'll conduct screening for cancer, screening for other diseases. She's able to treat the most common diseases and also dispense the medicine. So all of a sudden, these ladies, and most of them are women, these ladies become very important in their community. And you will see them treating up to 300, 350 patients in a month. And the difference they make in terms of transforming access to healthcare in a very simple and yet economically sustainable way. It's quite breathtaking.
Well, for people who know Cipla, that is actually an Indian pharmaceutical company. So where else in the world are you involved? And where else in Africa are you doing this kind of work?
So in Africa, we've got quite a significant footprint. We sit right across the southern region. Countries like Mauritius, Madagascar, Zimbabwe, Zambia. Up in East Africa, we're represented in Kenya, Tanzania, Uganda. And then up north, Morocco, Algeria, and Egypt. And so we've got a very significant footprint across Africa. And our main therapeutic areas we focus on are things like asthma, respiratory. We do cardiovascular disease, diabetes, women's health, men's health, cancer, gastro, antibiotics. So it's a very broad therapeutic range that we bring. And the critical focus here for us is driving affordable access to medicines across Africa. And I think we are well known from our days of HIV, where back in 2000, if you were diagnosed with HIV, it was a death sentence, because for many people at that time, medication would be costing in the range of $15,000 a year. So obviously for Africans, that was impossible. And it was Cipla that gave the commitment to bring it into Africa at $1 a day. And that opened up the floodgates for many, many people living with HIV to get access to ARVs. And I think that is what formed our legacy in Africa and gave us the belief that we can have a big impact on society. And now what we're seeing is that people are living longer. Life expectancy in Africa has gone up. It's gone up from the 50s and the 60s, and people are drifting up now towards 68 and to 70. And now, because they're living longer, other chronic diseases are now needing to be treated.
Are you allowed to tell us what kind of money-wise, in terms of rands and dollars or whatever, that FirstRand is contributing to this project?
It's a fairly significant amount. The ability for them to invest would take us almost up to 50 to 60 of these nurse units. So that's a significant investment. And remember, every container is a GMP certified container. So it's not just your classic metal container. This is a proper tailored built facility with air conditioning, temperature control, because obviously there's medication inside there, with proper data loggers. So it's a significant investment, and we're very proud of the partnership we formed with them.
Do people know about it in the communities? Does word get out there's one of these Cipla units that they can go to?
It gets out very quickly. It does. And I think when we start to pair it with the pickup points, then there's a natural draw on the patients to those locations. And we do spend a lot of money just really walking into the community and making the community aware of it. But I think the most critical factor is to put it in a high traffic area, as I said, like a taxi rank near a shopping center where patients naturally gravitate. But I think at those price points, many patients see value and the word of mouth gets out.
Well, before we let you go, I just want to ask you about, who you are, because I know that you used to work for AstraZeneca, who became so prominent during the COVID-19 because of the vaccine they developed.
Yeah. Always an awkward question talking about yourself, Linda. I think, I'm a privileged person. And I say I'm privileged because I've got to work for some incredible organizations that have put patients first. And I think in the last 12 years, I've had the privilege of working for an organization like Cipla that is passionate about access to affordable healthcare. And as a leader in Africa, the need is very high. And the determination and the passion from Cipla to have an impact in Africa is wonderful. And it's a privilege to be that person that has the voice and actually has the opportunity to drive that change across Africa. And I think as we move forward, we're really hoping that that impact isn't just in South Africa, but it goes from all the way from Cape all the way to Cairo. And that's our ambition. We're also excited about the fact that we're building manufacturing facilities across the continent of Africa. We have one in Morocco. We're looking also to see what opportunities there are in Algeria to replicate what we have in Morocco. We have 2 manufacturing facilities in Durban, large distribution center. So not only are we distributing medicines in the country, but also we're investing. And I think that's the most important point, that medication is one thing, but impact on society, both economic as well as from a health perspective, has to be a high priority for all of us.
And one thing we haven't talked about is the work that Cipla does with kids with cleft palates. You've been absolutely transformational in that. Tell us a bit about that.
Yeah. So many young children across Africa are born with a cleft lip or a cleft palate. And if left untreated, most of those children will probably die before they each reach the age of 1, particularly in your low-income spaces. It's obvious, right? You regurgitate, you can't swallow, you can't eat. And not only that, but these young children get shunned from society because obviously aesthetically it's not very appealing. Their speech impediment is there, and their learning gets hampered dramatically. Operation Smile is an organization that through volunteer surgeons, medical staff, orthodontists, psychologists, go on missions into Africa. And what they do is they do these repairs to these children. Quick operation, 45 minutes can repair a lip. Obviously, if it's a cleft, it takes a lot longer. But the difference it makes to these children is phenomenal. So we as Cipla, we have what we call Miles for Smiles, and we encourage people to get out there to run, to get active or cycle, but to raise funds and raise awareness for Operation Smile. So we're very proud that over the last many years, we have raised over 2,500 smiles for young children, and we've restored their future. And that's something we boast very often about. And thank you for asking the question.
Well, thank you, Paul Miller, for speaking to us.
Linda, I just want to say, thank you for the platform. And thank you for taking such time just to give us your attention. Often I think these activities, go by the wayside, but it's wonderful to give so many nurses a voice and just to acknowledge the work they're doing and the impact they're having on society. And I think we talk a lot about national health insurance in this country. And I think here are nurses demonstrating what is possible, that they have not only the education, but they also have the ability to run their own business and give scale and access to so many patients.